Before we fix your form, a quick ground rule. This is an evidence-based biomechanical breakdown of how to build core strength, not a medical prescription. If you feel sharp pain in your lower back right now, stop the exercise immediately. You're halfway through a 3-minute set, staring at the stopwatch on your phone. Your shoulders are on fire, your hips are slowly sinking, praying for the timer to end. You do this day after day, week after week, but after months of sweating on the mat, you still lack visible core definition, and your lower back aches every time you stand up. Being exhausted feels productive, but reaching physical failure does not automatically equal effective muscle stimulation. The central mistake holding back your core development is treating the exercise like a marathon against the clock. When holding a plank too long, abs lose energy. The load shifts away from your core, grinding into your spine and shoulders. This chart shows tension dropping flat past 60 seconds. You aren't building muscle anymore, you're just passively hanging on your joints. Treating the plank as a time survival test actively programs your body to rely on joint compensation rather than building true core strength. To actually build your abs, you have to shift your primary objective. Stop trying to accumulate time and start generating maximum, unbreakable tension across your entire body. It starts with your base. Crossing your hands might look comfortable, but it slumps your shoulders and kills your leverage. Instead, lay your forearms perfectly flat and parallel to the floor. This diagram shows the required alignment. Your elbows must be stacked directly beneath your shoulder joint to safely carry your body weight. Now, engage the core lock. Squeeze your glutes and tuck your pelvis to create a solid horizontal line. Correcting these bottom-up alignment points seals the energy leaks in your kinetic chain, forcing the muscles to carry the load and setting the stage for actual growth. To maintain that flat spine, pull your ribs down slightly toward your belly button. This specific rib tuck prevents your lower back from arching and stealing the physical load from your abs. Once locked in, apply the tension. Actively attempt to drag your elbows toward your toes without actually letting them slide across the floor. Because this level of contraction is highly demanding, we throw out the 3-minute rule. Replace it with a hyper-focused, high-intensity set lasting exactly 20 to 30 seconds. The exact second your hips sag, your shoulders shrug, or your biomechanical form breaks, the set must be terminated. A flawless 20-second contraction signals significantly more core hypertrophy than 3 minutes of sloppy endurance work. Eventually, holding that high-tension plank for 30 seconds will start to feel easy. Your first instinct will be to add more minutes back to the timer. Do not do this. Instead, apply progressive overload. This means making the movement mechanically harder without adding extra time to the set. This diagram shows the long lever method. Extending your elbows further out geometrically increases the downward torque on your abdominal wall. You can also introduce anti-rotation movements. Lifting one arm forces your core to fight massive rotational forces to keep your hips square. True core progression requires continually increasing the mechanical challenge of the position, rather than simply extending the duration. Stop watching the clock. Lock in the kinetic checklist. Elbows stacked, glutes squeezed, ribs tucked, and restrict your sets to short, maximum tension bursts. Pick just one specific mechanical adjustment from this video, like the elbow drag or the glute squeeze, and implement it strictly for your next 7 days of training. Track the variations you use and the clean seconds you complete. Actual physical change requires tracking measurable data over time, rather than randomly guessing your effort levels in the gym. A strong, aesthetic, and pain-free physique is built through precise, systematic execution, not arbitrary suffering.